बिस्मिल्लाहिर्रहमानिर्रहीम। इय्याका नअबुदु व इय्याका नस्तईन। अल्लाहुम्मा सल्लि अला मुहम्मदिन व अला आलि मुहम्मदिन व बारिक सल्लल्लाहु अलैहि वसल्लम. Dear colleague, this is made a 25-year-old patient with history of dysuria, urgency, increase in frequency, and burning duration. So I'm going to scan the pelvic region for urinary bladder. This is the urinary bladder, which is optimally filled, and here we can appreciate the debris, echogenic material, which is settled at the dependent portion of the urinary bladder, and this is the wall of the urinary bladder, which is thick all around. You can say that it is diffusely thick walled. So whenever there is such a sonographic picture and the complaint of urinary complaints, then we should focus on the urinary bladder, and also we should see the kidney. I have seen the kidney already, they are normal looking. So when we have seen such a sonographic picture, we should zoom the image so that we can have better and clear visualization of the urinary bladder and its wall and any contents within the urinary bladder. So I'm going to zoom it. So here we can appreciate this is the settled echogenic material, and this is the urine within the urinary bladder. So we can say there is a fluid debris level within the urinary bladder, and if we measure the wall thickness, it is 4.7 millimeter. So less than 3 millimeter is normal, and when it is optimally filled, and if it is underfilled, partially filled, then more than less than 5 millimeter, it should be less than 5 millimeter. So it is optimally filled, so we can say that it is thick wall. So we can appreciate now that the thickening is all around. It is, we can appreciate here, it is all around. So it is thick walled. And when we have observed all this, there is a fluid debris level, diffusely thick walled gallbladder, then we should also increase the brightness, because the brightness can also show many things. Here now, when increasing the brightness, we can appreciate the internal echoes within the urinary bladder. So when we have adopted this maneuver to change the setting, increasing the brightness, yes, and we see the internal echoes, then also we should ask the patient to have a tilt so that we should see what is the behavior of the internal echoes within the urinary bladder. So I have just tilt the patient. This is the urinary jet. Now then I am again asking the patient to have a supine position. And then again, toward the other side, and then again into the supine position. Adopting this maneuver, we can appreciate the swirling of the internal echoes, swirling pattern of the internal echoes. So all these findings which are we have seen by the ultrasound is likely suggestive of the cystitis. This is the acute cystitis. Otherwise, because we have seen that the wall thickening is smooth, it is not irregular, diffusely thick wall, and it is regular thickening. Not irregular means uh, at some place it is more, at some place it is even furthermore, and sometimes it in some places it is nodular. So this is not like this. This is smooth wall thickening. So for this reason we can say it is a case of acute cystitis. Cystitis may be infectious, non-infectious. It depends upon because in infectious it may be bacterial and non-infectious it may be drug-induced, chemotherapy, radiation, with what is that? Another condition, not recalling this time. So this in my opinion this may be the infectious because there is no history of drug therapy, chemotherapy, radiation. Also, it may happen in the vasogenic urine bladder. That is the non-infectious. So it, in my opinion, is the infectious cystitis, and it is acute case. We call it acute. So when you are going to measure the wall thickness, thus decrease the brightness and then measure it. While measuring it, we should also zoom the image and also decrease the brightness. While decreasing the brightness, we can appreciate the exact wall thickness and also the fluid debris level. So what we have seen in this, the bladder is diffusely thick wall containing the internal echoes that are coarse, giving the swirling pattern while moving the patient position and also giving fluid debris level, that is, all the findings are consistent with the acute cystitis. This is all about the acute cystitis. Thank you very much.